know, most people don't realize what an influence the French had in the development of our state. They were voyageurs and fur trappers who came in with the Hudson's Bay Company and other organizations in the early days of our territory and even before that. Today in Walla Walla and the Walla Walla Valley, just west of Walla Walla, you can see the remnants of one of the biggest French settlements. It's called Frenchtown. These are people that settled in after they left the fur trade business, often married Native Americans and found locations like this to spend the rest of their lives. It's truly one of my favorite places. Drive down the freeway near the Columbia River in the town of Woodland, Washington, and we see that big green sign that said Hilda Klager's Lilac Gardens. And we say to ourselves, someday I'm going to stop there. Well, I would urge you to stop. It is simply an incredible spot right on the Columbia River. Hilda Klager was an immigrant from Germany who loved flowers, and she learned to hybridize lilacs at an early age. She created all kinds of new varieties and gave them to her friends and named them after her associates and some of the towns along the river. And time went by and she had Lilac Week and Lilac Days, and people would come to this little farmhouse and they'd see the lilacs all through the yard. And then disaster struck. After the war, the Vanport flood did a terrible amount of devastation along the river. She was lucky her house was saved, big trees were still in the yard, but all the lilacs washed away in the flood. But her friends came to the rescue. They called her up and they said, Hilda, we bought one from you 20 years ago and we're bringing it back, or we'll do a cutting for you, or we've got this variety or that variety. And she started again to create this lilac gardens. She lived to be nearly 100 years old, and after she died, associates and friends in the garden club took it over, and today it's one of our state's nicest attractions. Go there when the lilacs are blooming, because it is something to see and to smell and to behold. Hilda Klager Lilac Gardens, one of my favorite places.
Watch all of TVW's award-winning shows on your time at tvw.org.
Well, here we are in the beautiful Puyallup Valley at the home of Ezra Meeker. He wasn't always a rich man and built a beautiful house like this. Started off poor in Ohio and Iowa and married a beautiful young girl, and they came west in the Great Migration of 1852. He first settled down the Columbia River and then moved here to Puyallup, Washington, in this fertile farmland, and started this town. Boy, did he grow. You could describe Ezra Meeker in so many ways. He was an author, he was a promoter, he was a farmer, he was a pioneer, he was a merchant here and in Alaska at the Gold Rush store. He did such a wide variety of things. In some ways, the Meeker family actually changed the cultural makeup of our state. The Native Americans from western British Columbia came down to pick hops in this valley. They came down by canoe. My father used to describe to me how they went by Bainbridge Island and on their way to pick hops for Mr. Meeker. And those people married into families here in the Puyallup Valley, and it's given us a whole new rich community because of that. Later in life, this man at an elderly age crossed our country 4 different times. He went in his wagon with his oxen and his dog Jim, and they traveled from town to town. And he sold these postcards along the way to raise money to build markers to mark every step of the Oregon Trail. He thought it should be marked all the way across and then eventually become a transcontinental highway. He knew that America could grow and develop if we had better transportation system.
Thank you for being here. My name is Parker Rickelman. I have the privilege of being the administrator here at Regency Canyon Lakes. On behalf of our entire team, I want to say a warm welcome and thank you all for giving us the opportunity to host this important event. We're honored to have you here today. Here at Regency Canyon Lakes, we provide short-term rehab and long-term skilled nursing, managing people with chronic and complex conditions. Our mission is centered on dignity, safety, and helping the residents maintain the highest possible quality of life. Our hardworking staff serve many individuals who rely on Medicaid for access to skilled nursing and long-term care. We also understand that Medicaid supports so much more. It's a critical foundation of care at all levels, from home and community-based services to post-acute and skilled nursing. As you can imagine, the work we do is deeply personal. Every person who walks through our doors brings with them a unique story, a set of challenges, and a need for compassionate, skilled care. For many of our residents, Medicaid plays a vital role in making that care accessible. The reality is that any cut to Medicaid funding doesn't just affect one line of care, it has ripple effects throughout our facility, impacting staffing, services, and ultimately the well-being of every person we serve. Today is a special event for me, the staff who work here, and the residents we serve. It's a reminder that the care we provide behind these walls matter far beyond them. We're proud to welcome a leader who recognizes the full scope of what Medicaid means to Washingtonians. Someone who understands that behind every policy and funding decision are real people, real caregivers, and real lives being impacted every day. It's my honor to introduce Governor Bob Ferguson. Please join me in welcoming him. Thank you.
Thank you very much. Thank you, Parker, and really the round of applause goes to you and your team and all the workers here. Please give a round of applause for everybody here for opening up this wonderful facility and all the important work all of you do. We really appreciate it. We're here today to urge Congress to abandon the harmful budget that proposes deep cuts to safety net services, including Medicaid. These Medicaid cuts are cruel and will harm many thousands of Washingtonians, all to provide tax breaks for the wealthiest Washingtonians and the wealthiest Americans, I should say. Republicans in Congress are proposing about $1 trillion in cuts over the next 10 years, including the largest cut to Medicaid in history, $700 billion. There have been proposals from the House and, of course, now from the Senate. So we're here today in the Tri-Cities to talk about these proposals with a particular focus on the most recent version in the Senate, which is unfortunately even worse than the House proposal. One thing I want to emphasize is that Central Washington, including the Tri-Cities, will be disproportionately harmed in both proposals, and I'll talk about that a bit more in a moment. There is still time to make this right, and that's why we're all here, to have our voices heard on behalf of so many Washingtonians who would be harmed by these cuts. I'm going to mention a few folks who are joined by Parker, of course, who you already met. You'll also be hearing from a few other speakers, and those are Imelda Salinas, who's a home care worker in Pasco, Thelma Hedrick, an X-ray and ultrasound technician at Cadillac Regional Medical Center's Emergency Department, and Britton Winterrose, the father of a child with intense medical needs who relies on Medicaid to stay alive. So first, I'm just going to take a moment to kind of give a brief overview of Medicaid in Washington State. Then we'll talk about just how devastating the Senate's proposal is and why we are urging Congress to reject it. And then, of course, you'll hear from our speakers who are the folks really on the front lines of what this budget back in Washington, D.C. would mean for literally millions of Washingtonians. Then we'll be happy to take your questions. And my understanding is the speakers are also available if you want to chat with them one-on-one afterwards. They're happy to do that as well. So Washington's Medicaid program, Apple Health, covers approximately 1 in 5 Washingtonians. That's nearly 2 million people. 800,000 of those individuals are children. Here in Central Washington, approximately 70% of all children are on Medicaid. We have a graph here that outlines exactly, county by county, what those percents are. But just to give you an example, in Benton County, it's about 55% of kids are on Medicaid. In some places, it's even higher. In Yakima County, approximately 80% of kids are on Medicaid. In Adams County, it's approximately 90% of kids who are enrolled. In 26 of Washington's 39 counties, more than half of all children are covered by Medicaid. Washingtonians depend on Medicaid for long-term care, including 3 in 5 nursing home residents and 3 in 8 people with disabilities. It's the largest payer for opioid use disorder treatment in our entire state. Medicaid touches health care in every stage of life for Washingtonians in every corner of our state. If a family of 4 makes less than $44,000 a year, individual adults in that family qualify for Medicaid. Children living in a 4-person household making $69,000 a year qualify for free health care under Medicaid. Medicaid also covers all foster children in our state. Medicaid reimbursements are, needless to say, also critical for hospitals, particularly those in rural areas. Approximately 25% of all reimbursements received by Washington hospitals in eastern Washington come from Medicaid. And just to give you a sense of scale of sort of the dollars around Medicaid spending here in Washington State and where it comes from, we spend approximately $21 billion a year in Washington State on Medicaid. $13 billion of those dollars come from the federal government. That's very typical across the country. But 13 of our $21 billion that we spend each year on Medicaid for all these critical programs come from the federal government. The House budget, our estimates from the House budget, would mean a $2 billion cut over 4 years. The Senate version is even worse and is approximately $3 billion over 4 years. So these cuts are profound. I mean, there's not another word I can really think of in terms of the magnitude of what these cuts would mean. This budget takes us backward, reversing the progress made through the Affordable Care Act. It also places significant limits on eligibility for the health care exchange and establishes burdensome verification requirements that will threaten viability of that exchange. In short, these budget cuts would fundamentally alter our state's health care system. As many as 200,000 Washingtonians on Medicaid will lose their health coverage in the first year if these budgets are adopted. I want to stress that this situation is, of course, fluid. A final budget has not been adopted. So it's hard to know the full scope until that final vote happens. And these estimates that we're providing today could, of course, grow depending on the final version adopted by Congress. But it's fair to say the proposals we're seeing so far, the one voted on by the House and the one being reviewed by the Senate, would be catastrophic for many Washingtonians. I also want to be very clear about why these proposed cuts are happening and why they're being discussed. President Trump is upending critical safety net services to give tax breaks to billionaires. It is that simple. It's a massive wealth distribution from the folks lowest on our economic ladder to those at the very, very extreme highest on the economic ladder. You know, it's sometimes hard to put into words exactly what something like this means. You know, but I know you'll hear from other speakers who will talk about what the impacts are on them. But you know, to my mind, you know, these cuts would be cruel, and these cuts, in my view, would be morally wrong for us as a country and for us as a state. I also want to say that Medicaid cuts do not only impact Washingtonians on Medicaid. I really want to emphasize this. It will send shockwaves through our entire healthcare system, impacting Washingtonians in every corner of our state, whether they rely on Medicaid or not. Additionally, the administrative burden caused by overhauling our healthcare system and Medicaid is expected to cost the state tens of millions of dollars at a time when, as you know, our state faces significant budget challenges. What you will see if this goes forward is hospitals will close. So you may not be on Medicaid yourself, but guess what? You go to a hospital that may close because of these cuts. Many hospitals across our country and in our state are hanging on by a thread. That's the reality right now. Nationwide, about 1/3 of all rural hospitals are at risk of closing. Estimates show there are 31 rural hospitals in Washington state already at risk of losing services, 18 at risk of closing, and 7 at what we would describe as immediate risk of closing. These Medicaid cuts will make this crisis even worse. A report released this week from the National Rural Health Association estimates that these hospitals will lose 21 cents out of every dollar they receive in Medicaid funding if this proposal passes. I think, you know, you don't have to be an economist to understand what that would mean for hospitals all across our state, rural and urban. So what I'm going to do now is turn to our speakers, who I just want to say before I do turn to them how much I appreciate them coming and being willing to speak in front of a group of cameras, and to the people of the state of Washington directly. I always find that the most impactful speaking at these press conferences is, you know, not from an elected official, but rather from the Washingtonians who are going to be directly impacted by, in this case, really significant budget cuts. And so it's my real honor to turn to those individuals now. Thank you so much.
Thank you. Thank you. Thank you, Senator Ferguson. Hello, everyone. My name is Imelda Salinas Gomez, and I am from Pasco. I've been a caregiver for 25 years, and I have taken care of many, many people. I experienced the importance of Medicaid as both a caregiver and a family member. My client right now is a little boy that I have cared for over 8 years. He was 6 years old when I started working with him. And he doesn't have any feelings from his waist down, and has more surgeries that we can count on. And he has diabetes and needs medication, and travels to Seattle for treatments. Every year he has many, many treatments. He has a Medicaid device that goes from his head to his waist down to keep him alive. That way he can survive, walk, and talk. He has, not an easy life, and also has a really good family to count on, and myself as his caregiver. Last year, he had 2 surgeries because he grew, and the shunt was caught. So he had those 2 surgeries. And he told me that he was really tired of being sick. And, it just breaks my heart to hear him saying that. So this boy depends on Medicaid. He will not have the care he has right now and stay alive if Medicaid goes away. So I also have a brother. My brother has kidney failure, and he goes to dialysis 3 times a week. Is on the waiting list for a kidney replacement. He's been on dialysis for 2 years. Now he's on the list, and it takes 3 to 5 years to get a new kidney. But we don't have that much time because the cuts to Medicaid will take away his insurance, and also he's changed to a new life. So this is very important to me. Just this week, he had 2 surgeries at once. He would not be able to have those surgeries if Medicaid goes away. So the program that he's enrolled, it will be the first one to go when this law goes through. So he will not have any time to live. It takes only 4 to 5 days for a person that doesn't have his dialysis to die. So I am sorry if I am too emotional, but it affected me to the heart. So that's why Medicaid is so important for my client, my brother, and all the people that have Medicaid, my clients. So Medicaid keeps people alive. Our communities need it. Without Medicaid, nobody will have the care they need, and it will die. Not just my brother. There's too many people on dialysis. So please, Congress, do the right thing. Protect Medicaid so that my brother and my client can have a chance of life. Thank you so much for being here and to listen to my story. Thank you. Now we have Thelma.
Thank you, Imelda. Hi, my name is Thelma Hedrick, and I'm an X-ray ultrasound tech from the Freestanding, just down the road. Been in the healthcare services for 30 years, 11 of the past at Cadillac. I've seen a lot of changes take place, and in those 30 years, you will learn to adapt. There's no adapting to this one. This is detrimental. In a day's work, we handle x-rays, we do ultrasounds, that's the obvious. We do CPR. We hold the hands of the people that are passing away or fighting for their lives. We take our job extremely serious because we so much care for our patients. When they walk through the door, we don't care if they have insurance or not. They are our priority. On a daily basis, though, if we order studies for them, they will ask us, how much is this going to cost me, even though if they have Medicare. So now imagine, if you will, what happens if they lose that. We've seen people just go, I can't afford that, and walk out. For us healthcare workers, the action that Congress is taking is as important as any that we make for our patients. Lives are at stake, literally at stake. We take our responsibilities seriously, and we need our elected leaders to match us in that responsibility. I want our elected officials and the public to know that even the actions that have taken so far have already had a negative impact on our local hospitals, our home health care, our everything. It changes because you have to adapt for the possibility of what's coming. In our case, that means that they have already looked at attrition or eliminating of jobs and relocating them. Hiring freezes. We are short-staffed at the Freestanding. We're short-staffed at the main hospital. And how do you think they'd feel when I do an ultrasound and they're coming in, they're concerned about their baby, and I have to tell them, or they have to tell them, I'm sorry, no ultrasound tech is on staff. Or, I'm sorry, you're going to have to sit here for 3 hours because we don't have enough people to do the ultrasound right now. We can try to call someone in, or you can go over to the main hospital, again, delaying the care. And at worst, some of them for surgeries, appendicitis, have to have the gallstones removed. There is that massive delay because maybe there's not enough nurses over there to help in surgery. And all of this has to be taken into effect and into thought process for the hospitals. And it's not the hospital's fault. It's not Cadillac's. It's across the country, as our governor has said, that they have to look at these possibilities. People are going to choose not to have the health care if it means that they have to pay out of the pocket for what limited funds they have to keep a roof over their head. And I'm sorry, no patient should ever have to make that choice, ever. My coworkers and I are deeply frustrated at this chaos created by the leaders who do not know what patients' needs are and are not listening to the people that are important that deal with these patients every single day. We show up every day for our patients, and we're calling on our elected officials who are threatening Medicaid to put patients and healthcare workers at the center of that decision. Bottom line is Medicaid cuts are not going to save the taxpayers any money. Not at all. People will defer their care, as I said, and the health conditions will worsen, and then when they really, really need it, that is really going to be expensive for them to get the care. I expect that my elected officials won't always agree with me, and it's okay for them to say no when they have the information that tells them that the right thing to do is to say no. And that's across the board. If they know it's the right thing to do, say no. No facts exist that says cutting Medicaid is right for the community. We need leadership, and right now to stand up and stand up for us. I appreciate it, and thank you very much for your time today. Thank you, sir. I'm sorry.
Hi, kiddos. You want to help me out? Hi, everyone. I'm Britton Winterrose of Richland, Washington. I'm a director at Microsoft, and I'm father to these two wonderful kids and one other daughter named Lita. Lita is 5 years old. I'm here today to speak to you because without Medicaid, Lita's next nap could be her last. Here, do you want to hold this picture of Lita for me? Hold it so they can see it, okay? Lita entered the world at the height of the pandemic and spent the first 45 days of her life in the NICU. Doctors finally identified a rare form of congenital central sleep apnea. To put it simply, if Lita falls asleep without oxygen, she will die. The only path out of the hospital was a Medicaid waiver that paid for in-home nursing and life care support. Medicaid gave us the opportunity to bring Lita home, surrounded by her siblings and the normalcy of her parents who love her. Her siblings love her a ton too. Since that day, Medicaid has kept up with Lita's needs as she has grown. It's provided us money for paid caregivers, to support from our family so that Lita can remain in our home. A toddler who once needed a walker now sprints across the yard because Medicaid funded the therapy and the walker that helped her to strengthen her legs. It's provided her with a bed that keeps her secure so that her equipment stays attached at night and we can sleep. Each new stage of her development adds new hardware, new supplies, new specialists, feeding supplies, feeding pumps, G-tubes, sensors, diapers, respite care, and an AEC device to help her communicate. Private insurance, even the premium plan that comes with my job, rarely covers this equipment. There's just not a private health insurance on the planet that covers all the edge cases of human experience for someone with medical complexities like Lita. Tonight, like every night, my wife and I will hook our daughter to her oxygen concentrator and a pulse oximeter. We'll lie down in our beds and we'll say no to death. The only reason we get to sleep at all is because Medicaid has provided the durable medical equipment and supplies needed to support her. From those exceptionally long days in the NICU, all the way up until now, one thing has become obvious to me. The last question on anybody's mind when they're trying to keep their child or loved one from dying should be, how can we afford these things? I don't speak only for Lida. The bill before Congress would strike thousands of Washingtonians from the rolls of Medicaid. And when that happens, the clinics and long-term care facilities that support these individuals will collapse. That blow lands on veterans, on cancer patients, on newborns in rural counties, as surely as it lands on my family. Nobody wakes up and decides, oh, I want to be disabled today. Everybody's health is a roll of the dice. Medicaid is how we make sure that roll is not fatal. I still lose sleep sometimes over what will happen to Lida when I'm gone. As a tired dad, my plea to Congress is to help me rest. Please defend and strengthen Medicaid so that Lida and every child like her and those who are rightfully dependent on the system can live and thrive. Thank you. Thanks, kids.
Sorry. No, you're good. Just stay up close. You're good, yeah. Thanks to Britton and to all of our speakers for, sharing their deeply personal stories with all of you and all Washingtonians. And, it's our goal is... Sure, I will do my best to speak up a little louder. Thank you. And I think that it's critically important right now for all members of Congress to listen very carefully to the individuals who just spoke and to reflect deeply on the consequences of the votes that they are taking. And I get that there are numbers, dollar signs around different votes. I'm a political person, I understand that. But what I want them to do is look behind those numbers and to see the faces of individuals who will not just be impacted by their decisions, but profoundly impacted by those decisions. So again, I really appreciate everybody who's here and is speaking. And with that, we're happy to take some questions from anyone who might have them for us. Or we're all getting off very easy on this beautiful day, which is always good too, and we're happy to chat afterwards.
So,
yeah.
Representative Newhouse
yes.
Recently sent me a comment.
You bet, take your time, yeah.
So, he said in response to Senator Cantwell's estimates of how many people in this area would lose coverage, he said 4.8 million able-bodied adults choosing not to work while receiving taxpayer-funded benefits, as well as 1.4 million illegal immigrants that have been allowed benefits by states without repercussions. Benefits, individuals who are eligible for Medicaid and satisfy the work requirements will receive coverage. That's his take on it. Do you want to respond?
Yeah, I mean, it's a morally bankrupt statement.
How so?
How so? Well, it's some D.C. talking point from the Trump administration. And what I would say to Congressman Newhouse and to every congressman who's parroting that talking point is, guess what? We actually have data around this. Real facts, those things exist still in the world. And there are states like Arkansas, as one example, that actually tried a pilot program a few years ago. And guess what their pilot program was? This exact same thing. It's this whole idea, people would only just go to work. Guess what Arkansas did, one of the deepest red states in our country, after they tried this pilot program? Guess what? Total failure. They didn't save any money. What they did was people lost access to health coverage. They had additional administrative costs to the state that cost more than any savings they realized. And guess what they did after a couple of years? They dropped the pilot program because it didn't work. So I'd encourage you to reach out to Representative Newhouse and ask him about that. But I'm sorry, in response to this, okay, I would encourage you to send to him Britton's testimony or Emilda's testimony and respond specifically to that. That's the question. Not good Lord, right? Maybe dig a little deeper into the community and the impacts that are happening here. It's only people's lives that are being impacted by these decisions. And honestly, folks he's a member of Congress. He's one of the most powerful people in the country. Take a look around me. I don't see a ton of powerful people here. They're just Washingtonians trying to provide for patients, trying to live their lives, trying to take care of their kids. Right? So I would encourage him to sit down with these individuals here in his district and meet with them face to face, and maybe try to go a little beyond that, empty talking point, and look them in the eye and promise them that their lives won't be uprooted by this. I'm confident that if every member of Congress had a child with the condition that Britain's daughter has, they would not be taking this vote. Anyway. Yes?
If this were to way we're actually passed at the House, is there any defensive method that you have for the state of Washington to kind of like repeal that, or so that way Washingtonians won't be affected by this?
Thanks for that question. I'll repeat this so folks listening in can hear. So the question is basically, hey, if one of these versions of this budget goes through in Congress and is signed into law, is there something the state of Washington can do to essentially backfill or override that? It's a good question. So first, what I'll say is we are, of course, within my office, we've created work groups to kind of analyze what's going on. And obviously it's changing and fluid, but to understand what the numbers are, what the impacts are. That's number one. Number two, the team is working hard to provide some options to me about what we might be able to do. I want to really emphasize, look, if, for example, the Senate version, which would cut about $3 billion over 4 years to Medicaid, we don't have $3 billion lying around, to put it very mildly, right? That doesn't exist. So there would be no way to avoid drastic cuts to individuals in our state. That I wish I could say something different, but I have to deal in facts, right, and reality. Obviously, of course, we would do everything we can in our power to mitigate those harms as much as we possibly can. That's going to take a lot of work and complex work to see what the final version is and to see what our options are. But from our own financial situation in Washington State, as you know, we just got a budget forecast for the next budget, and over the next 4 years, we have a $700 million shortfall. Right, our budget's going the wrong direction, and so as I've often said, we have big budget challenges as a state. But those challenges will truly turn dire if cuts like this are coming from the federal government. So I think it's too soon to speculate, but no, there is not some magic wand that I have that I can wave that's going to solve this problem, not by any stretch of the imagination. There'd be real impacts, real harms to real Washingtonians. That is unfortunately the case. But of course, we'd be working with the folks here, stakeholders, you name it, the legislature and many others, to do everything we could to try and mitigate that as best we can.
Is there anything that a person that's probably not involved political can do at this point in time to kind of make an impact and have their voice heard, so that way Congress knows, like, hey, this will impact a lot of people?
Yes. So the question is, hey, are there things that Washingtonians who aren't in positions of powers can do around these proposed cuts? The answer is yes. And so others may want to add to this as well, but I think you're seeing examples of what folks can do. And these folks are here at a press conference, but guess what? Most of us have access to social media, right? To communicate your own story, right? If you would be impacted by these cuts in some way, I'm a big believer that individual stories carry a lot of weight. And to communicate that in any way that folks can makes a big difference. Number two, what I would say is, look, in the eastern part of the state, we have 2 members of Congress who voted for this budget in the House. Those are the representatives. You live in eastern Washington, those are your elected officials in Congress. You can write to those people. You can ask for a meeting with those people. You can communicate directly to them. You can also write to other members of Congress as well. But I think especially focused on folks who represent you right here in this part of the state, I think is obviously something that that folks can do if they have strong views about what's happening in Congress. Happy to invite others to add anything if they wish as well. But those are 2 things that we're going to add, Carver? Okay, but those are 2 things that definitely come to mind. Yeah. Any other questions we have?
You briefly mentioned you said that the state had made a lot of progress under Affordable Care. Can you briefly explain what you're saying there?
Sure, I'll definitely defer to others who are more experts as well. But and the question is how Washington State has made progress in this area. Well, certainly with the creation of the Affordable Care Act and the ability of Washingtonians, thousands and thousands of Washingtonians, to gain access to health care in a way that they did not have before has had a profound impact on the lives of Washingtonians and Americans all across the country, right? There is a reason why the Affordable Care Act has survived all these years, right? It is popular. It saves lives. It gives people health care coverage that they most desperately need. And so for Washington State, that has been a huge help for us through Apple Health as well, to provide assistance to folks who need just the basics, the right that they have to health care. So yes, we've made progress, and much of that would certainly be undone if this was to go forward. But I'll certainly defer to others as well who may have some thoughts. Sorry for the fly that's right here, but does anybody else want to jump in on that? Absolutely, 100%. Then we'll go right ahead. Yeah.
I just want to add to that, if I may, looking at it from an emergency room basis, is that with the Affordable Act, people aren't, as I stated before, having to make the choice. Do I get the health? Do I take care of my health, or do I buy food for my family, or pay the rent for the house, or whatever? They are able to get the help they need, stay healthy, and to stay healthier, they don't need as many medications. So it's a win-win situation in this one. They stay healthy, they get the help that they need, and they get to keep their homes.
And so again, everybody's available afterwards to share some thoughts. If you have additional questions, they're happy to do one-on-ones. I want to thank everybody again for sharing your stories. Parker, thanks to you and your team for all you do, and the folks who provide the critical service here and the work day to day. We deeply appreciate it. And look, just come back to to our representatives here in Eastern Washington. Look, if Congressman Baumgartner and Newhouse would like to meet with any of these individuals, I'll be there as well. We'll send the invitation. I'll be happy to join. And to make that happen, I suspect everybody here would be more than happy to sit down and have that. Yeah, I'm hearing an invitation that we will more formally extend. And look, I'm not trying to be critical of anybody, right? But I just think we got to be real about what's going on in our country right now on many levels. And the level we're focused on right now is pretty basic to, I think, human dignity, and to keeping people healthy and keeping people alive, including some of the most vulnerable Washingtonians that we have. And so we'll extend that invitation, and we hope that he or members of his team are willing to have those conversations. We would certainly appreciate that, and respectfully will request it. Thanks so much, everybody. We appreciate all your time. Yeah, appreciate it. Thanks, everybody. Yeah, really appreciate it. Thank you so much. So appreciate it. Yeah, so great to see you.
Thank you.
Great job. You did a great job. Yeah.